I'm Dr. Goodside. I'm at Shadowman Medical, and I'm going to do an experiment that I have done in the past, which is I'm introducing some of my patients who are giving live testimonials about their experience getting regenerative medicine, either PRP or something else. There's Silva, Al, and Lori. In the past, I've done this. I had a patient who was a landscaper, spoke very little English. He sat in the lobby and he sold 5 PRPs, 5 treatment plans to 5 different patients who were sitting here with him. So I'm going to try to repeat that experience. You're more than welcome to come in for a free consult at any time. You're more than welcome to watch the regenerative medicine testimonials on our website, which is at Shadowman Medical. And in order for you to believe that I'm not prompting them in any way, I'm not staying. So see you later. Enjoy my friends.
Thank you, doctor.
Thank you, Dr. G.
Take care.
All right, everybody, we have about 6 people watching us now, so let's go ahead and get started. Lori, we'll start with you at the left if you want to just tell us a little bit about yourself and what interested you in seeing Dr. Goodside, and then we'll go with Al and Silva after that.
Hi, good afternoon, I'm Lori. I have been a patient with Dr. Shadowman now over 8 years. Met him through a mutual friend and came in. I had some lower back concerns that I initially had come in for, and one of the things I had learned in my visits from Dr. Goodside was that after my 3rd blessing of childbirth and 4th, my lumbar would freeze and would limit me from, it would contract and then it wouldn't come back. Or it would stretch out and it would not contract. So it caused me to be hunched over, in a great deal of pain. Adjustments helped tremendously, but it didn't take it for the long term, which I was hoping to get, and recommended PRP for me. Since I've now had it twice done in my lower back, my lumbar, and I think my lower back has now froze up in 4 years twice. And it limited me for maybe a couple hours until I could get in to see Dr. Shadowman, get an adjustment, but my therapies and follow-ups from then on have been pretty substantial as far as not having that difficulty. Prior to that, it was maybe 2 to 3 times a month that it would freeze up, and now I'm very happy with the results.
Right. All right. Thank you very much, Lori. All right, Al, we'll go ahead and go with you.
How you doing? I'm Al Viscusi. I own a meat market. Mutual friend turned me on to Dr. Goodman and didn't think it was going to work, but I was amazed. My shoulders, I have torn rotator cuffs on both sides, and it seemed to be an amazing blessing for me. Got them done and went right back to work the following day.
Good, thank you. And you said you didn't think it would work for you, Al. What made you think that it might not work?
I was very skeptical of it, but a mutual friend of mine, she had her shoulder done, and it was amazing. She was riding again and moving her arm, and that's what brought me here to do mine. Couldn't afford to take off 6 months for surgery,
Yeah.
so it was easier doing this, and if it's going to work, I'm all in.
Got it. Can you tell us a little bit about if you had any downtime with the PRP? How much downtime did you have compared to those 6 months? None. Good.
And I'm not taking any pain pills for it or anything anymore. That was the best part.
Thank you very much, Al. And Silva, can you tell us about your experience?
Yes, hi, my name is Silva, and I've had neck and shoulder pain with headaches for almost about 3 years now. I have worked with chiropractors before, and me as an employee, as a licensed massage therapist, working with patients, using a lot of my upper posture, working with patients, I've always had tension and neck pain, which causes a lot of headaches. I've tried trigger point injections with nurse practitioners at other chiropractic offices. It gave me a little bit of relief, but it would always come back to the same tension because of the position that I do. And lately I started experiencing daily headaches for almost 2 weeks nonstop, waking up with headaches, sleeping with headaches. No matter what we do, it doesn't go away. I've tried my massage therapist on it. It will give me a relief again and go back to it. So when I met Dr. G convinced me to try PRP, and I did see a lot of patients and getting a lot of positive results from their PRP. So I said, okay, why not? I would try a PRP since it's a natural regenerative medicine treatment. Nothing from outside goes to your body. It's completely natural. I said I would rather try it and see the results. Believe it or not, within about 2 hours after that treatment, my headaches was completely gone. I had no headaches, and I still don't experience any headaches until today. I have very, very little tension on my shoulders, which is normal with my position because I do have hands-on on patients every day. But overall, I could say I'm 99.9% better with the PRP. It really helped me with my headaches, with my neck, my shoulders. I don't wake up with headaches. I don't have neck pain anymore. So I've had great results. And I would recommend to anyone that has been experiencing a lot of pain and don't want to go through surgeries to fix their problems, PRP would be the #1 procedure that you can try since it's completely natural.
Yeah. Thank you, Silva. You mentioned that you had tried trigger point injections for Elle and Lori. Lori, I know you mentioned you had chiropractic as well, but Al, did you seek any other treatments before you finally decided to make the decision to treat with Dr. Goodsight?
Just taking pain pills.
Pain pills, yeah.
That was it.
Yeah. How long did that last? How long were
I
you
was-
doing that for?
Year
Wow.
where I decided I got to do something. I couldn't afford to take the time off from
Right.
work to
Right.
have surgery. Just wasn't enough for it.
Yeah.
So I dealt with the pain for that long until luckily I met Dr. G. Amazing. Totally.
Very good.
Helps me out big time.
Very good. And for each of you, I'll ask, how soon were you able to make your appointment with Dr. Goodsight from when you came and you had your initial consultation? Did you have a long waiting period to be able to have the procedure done?
No.
Okay.
As soon as I called, I had an appointment.
About a week, if anything,
Yeah.
right? Okay,
Yeah, within a couple days we were
Yeah.
in process.
got it. And Al, I know you mentioned you didn't have to miss any work. What about for Lori? I know you had the low back done. Did you have to miss any work or any activities that you had to stop doing while you healed?
He
What was that
gave
like?
me a few mild restrictions as far as, lifting certain weight limit, for the first few days. Some
Mhm.
small, minor exercises to do
Mhm.
and to be mindful, different workout, little walking exercise type thing. Other
Mhm.
than that, there were very little, if any, limitations. I mean, just a little cautious couple days and that was it.
Got it. What about for you, Silva? Any limitations after? Any major discomforts after?
Discomforts, no, not at all. But he did give me supplements that I should follow with, and the supplements really help. So I was following on that, but I just took the rest of that day off just to rest my body and my shoulders, not doing massage therapy.
Mhm.
But and then the following day, since I was almost 100% better, I was already back to work with no restrictions. I was just taking it a little easy, but overall, I didn't take any days off or anything, restricted anything from doing anything because of the procedure. It was just going back to a normal life without any restrictions, just taking it a little easy for the first week.
Got it. I do have a question. I have somebody asking, did you feel like all of your questions were answered before you received treatment? Did you have enough time with the doctor? How do you feel that went prior to your treatment?
Yes, absolutely. I know I did. Because Dr. Goodsight always has consultation with patients to answer all patient questions prior to doing the procedure, and he can answer anything you have until you feel comfortable, and then you get your procedures done. Yes, to answer that question, you do get all your questions answered before you do any procedure.
Okay.
Yeah, I feel the same way. Every question was answered. It just came down to me if I really wanted to go through with it and believed it.
Right.
But it worked.
Right.
seeing a friend of mine have it done and it worked for her, I knew it was definitely something to try.
Good. What about for you, Lori? You had been a longtime patient of Dr. Scheitelman, right? So you kind of were referred to Dr. Goodside. How was that? Did you feel like they were on the same page as far as your treatment plan? And
Yeah, most definitely. Dr. G educated me, answered my questions all in the same, 10-15 minutes that we spent together talking about it, because I had no idea that was what the cause of it was. I knew how to temporarily or help the situation, get me through the day or the week with adjustments and therapy, but the PRP definitely made a huge difference in my everyday life.
got it. I have a question. As far as after your procedure is done, do you see the doctor after that, or is it just a one-time thing and you don't see him? What was that like for all of you?
I saw him following week. I came back afterwards and had to massage and then talk to him again, see how it was, and it was very easy.
Good. What about for you ladies? Was that explained the treatment plan? Was that
Yes,
an easy
absolutely.
experience?
He
Yeah.
does explain to you during the consultation and during the procedure that you need to come back at least 3 times of follow-up with Dr. G once a week. That follows with a 10-minute of massage and then massage therapy, and then you will meet up with him to see, to get some updates of where you're at and how you're feeling right after the procedure, if you're taking your supplements, and anything concerning you still have after that procedure. He will answer all those questions at that moment, so you'll take the following weeks, you'll know what to do from that point on.
Got it. I do have a question for everybody. I have somebody asking, how much does it hurt?
It doesn't. It really doesn't.
Yeah.
You're easier than getting blood work.
There you go. There you
Easier
go.
than getting blood work.
Yeah, I think a lot of people hear procedure or they think needles and they think it's very invasive, and it really isn't. Can you all just talk about, well, you just explained it right there, right? Easier than blood work.
Oh, without
Right.
a doubt.
Yeah, yeah. And they asked, if it does hurt, how long does it last?
Pain?
Yeah,
10 seconds,
If
15,
that, a
15.
second.
if that.
Maybe
Yeah.
a second. It's not even, it's like a pinch.
Yeah.
That's it.
That's exactly
Yeah.
what I was gonna say.
It's just like-
It's exactly just a pinch.
Yeah.
A little pinch at that second, and then it'll go away. Well, Dr. G is really good at numbing that area first a little bit. And then
Yeah.
so what you feel is just a little pinch, and then if you count to 10, probably before you get to 10 at that counting, that procedure will be done already. So that's the only thing you'll feel. It is definitely, yes, easier than getting a blood test done.
Thank you. I have another question that says, how long did the procedure take? How long were you in the office that day?
Start to finish, about an hour.
Hour?
Yes,
Yeah.
definitely.
Come in,
Yes.
answer any questions, right, that you may have right before they get started. They drew our blood.
Yeah, wait
Dry your blood
20
and-
minutes,
yeah.
30, and then go back in and have them shoot the shoulders. It didn't take long,
Yeah.
if an hour.
Yeah,
It
so
wasn't
you would
that
all
long
agree
at all.
about an
Yeah,
hour
definitely,
typically?
45
Yeah.
minutes to an hour,
Yeah.
because everything's quick. Dr. G has his staff that working fast, everything moves on really fast.
Yeah.
So they'll just take you in right away, take your blood, within about 10-15 minutes, you'll go back in there, they do the procedure, you get the therapy, he explains to you everything, gives you the supplements, and then you make your next follow-up appointments, and then you're good to go within about an hour.
Very good.
What shocked me with everything is just, I ride motorcycle and holding your arms out, and I couldn't do it before that long. Go 200 miles, never a problem. I'm not hurting, big difference.
How soon after the procedure were
I
you able to
waited
get
a
out
week.
and
He wanted me to wait
Right.
longer, but I waited a week, and then I was out again riding, and it
Nice.
have no problems with
Very nice, very nice. And we have a follow-up question that asks, were you able to just leave, or did you have to bring somebody with you? I think a lot of patients think there's gonna be a lot of downtime
Not
with a
at
procedure
all.
like this. Yeah, so, All right, everybody drove home that day,
Yep.
right?
Oh, yes, you don't need, you
Yes,
don't
ma'am.
feel dizzy or anything,
No.
you don't
Right.
need anyone to escort you back home, you'll be completely
Right.
fine and even feeling a lot better with no pain.
Right,
You're just driving back home as
I
normal,
agree.
yeah.
Right.
You don't
Definitely
need
agree.
anything at all.
yeah. I think if anything, what we do encourage patients is because we are gonna draw your blood, to drink a lot of water, right? Make sure that, or if you get lightheaded, we've got candy, we've got sweets, you know, we can take care of you as far as that aspect. But it is minimally invasive, which is really nice. Oh, we have another one that says, how many times did you have to have a PRP done? How many times did you do it? The PRP?
Once.
Once. There you go. What about you, ladies?
Yes, it was my first experience and absolutely the last because I am absolutely with no pain, so yes, I did it once.
I did do it twice.
Mhm.
I got 4 children, so my lumbar was a little difficult.
Yeah.
But I did have relief for just about the 2-year mark, and it gave me a little bit of trouble. I spoke to Dr. G, and he said, let's do a second time, and I'm really hopeful that I will have a very long results with this one, so for sure.
All right. And Al, I have a question specifically for you. What was your experience like, not only with Dr. Goodside, but with the office? What was that like for you?
Pleasant, all accommodating, really easy. Didn't have no problems with anything.
All right, everybody. Any final thoughts? Anything that you'd like to share with anybody out there who might be watching, who may be on the fence as far as should I do this? Any final thoughts?
I'm just a non-believer. I don't believe it until I actually see it. So it was seeing someone else have it done and it worked for them. I was convinced.
Thank you, Al.
Just got to go into it with a positive thought.
Thank you.
And I would definitely recommend anyone that was told that you need to see an orthopedic surgeon, get surgery consultations. I would recommend them to come meet Dr. G, get a free consultation at no charge, get all their questions answered before they go see any orthopedic surgeons. As we all know, orthopedic surgeons usually 99% of the time their recommendations are surgery. And that's what we're here for. That's what Dr. G is here for. He definitely will help you get through this without any surgeries and healing you faster in a natural way.
Thank you.
I
What about
totally
you?
agree and second, third, all of that. Additionally, any downtime or any pain that's associated with this procedure, as minimal as it is so much better than healing or the pre-surgical procedures and then the post-surgical procedures and all of the downtime. So those pieces make it priceless. I mean, this is amazing what our body can do. Thank you, Dr. G.
Yes, thank you so much, Dr.
Yeah.
G.
Yeah, big time.
Thank you all for joining us. I really appreciate it. If anybody out there watching has any questions, feel free to call us. Our phone number is on our Facebook page, or you can call us at 623-214-7600. Also, feel free to visit our website. We have more testimonials. That is www.smedcairo.com. And come and see us. Free consultations. We can help you with your pain. Thank you, everybody, for joining.
Thank you.
Bye-bye.
Bye-bye.